The Susan Brender Show is a radio show online broadcasted on YouTube across the United States and globally. The show features guests who speak about health, spirituality, entertainment, and a host of subjects to enlighten people across the nation. Listen to the show that empowers women and men alike and highlights those who have made a difference. I'm Susan Brender, and this is the Susan Brender Show. Whether an injury was sustained from a sport, work, everyday life, a car accident, or surgery, have you seen it, and can you help a patient to overcome it? That's the kind of question that I want to ask both Kristy and Scott Miller. By the way, Scott Miller is the owner of the Scott Miller Physical Therapy, and Kristy also works there as a physical therapist as well, and both of them are fabulous, and they do a great job, and people ought to know about them, because if you want to have really a good body, a strong body, those are the people to go to. With that said, let's ask that question again. So let's start with you, Scott. I'm going to say it again, whether an injury was sustained from a sport, work, everyday life, a car accident, or surgery, have you seen it, and can you help the patient to overcome it?
Absolutely. And well, first of all, Sue, thank you very much for having me on your show. It's always a pleasure speaking to your fans and being on your show. Yes, absolutely. That's what we do for a living. When someone is sustains an injury from an accident, from playing sports, from a slip and fall, from any type of accident, they usually come to us to help them return to their normal function and to get better and to feel back to 100%.
Yeah. Kristy, tell us a little story about somebody who you had as a patient who suffered an accident, and what really happened, and how did you take care of them?
Hi. Thanks, Susan, again for having me on the show. It's always a pleasure to speak with you, and I enjoy seeing you, and I'm happy to help your fan base. So we see all different types of injuries here. So I would say, in particular, the most common one we see a lot of is back injuries. Back injuries are so common due to the repetitive nature of even everyday life. I've had patients come in here into the office in intense pain, could barely walk, and we start by doing the assessment and seeing their movement patterns. And each case that we take, we break it down. We take a thorough history and really get to know the person, so we can help to figure out how to best help them and solve their problem. And it's really a step-by-step process. From day one, we got to first focus on getting them out of pain, and that can take anywhere from a couple treatments to a month. Everyone is a little bit different, and then working to gradually restore them back to function. The ones we've seen great success and have great success stories of getting people back to doing everything that they love to do.
Yeah. Scott, it's a very interesting thing. As the audience should know, I'm a patient of yours, and I have found that each time that I go to your office, I find myself really getting better and better and better. And that feeling of just getting better is unbelievable, because when you have pain, there's nothing worse than that. Do you agree with me on that, Scott? And how do you deal with it? A person comes into your office and they said, Doc, I'm in so much pain and I don't know what to do about it. I've gone for acupuncture. I've gone for, any other thing that will make me better. I mean, orthopedist, you name it. But I need to go to somebody who can really reduce the pain. So how do you handle that, Scott?
Well, no, that's a good question, because pain can be not only physically debilitating, it can be very, very mentally draining and mentally debilitating, and can just affect every part of your entire life. So, as physical therapists, when we see patients in this much pain, we not only have to, talk to them about, what's going on with their pain and try to alleviate their pain, but we need to try to have them or try to at least help them manage the pain that they're having, both physically and mentally, and try to explain to them that this is something that's, one, it's not going to be forever. And a lot of patients, when you're in that much pain, you think it's never going to go away. So that's part of our job, to really kind of explain to them the process of how and what we're doing, so that they understand that, okay, I'm going to be in pain this week and maybe for a couple treatments, but, hopefully over the course of some treatment, a few days, a few weeks, the pain's going to start subsiding. And then once the patient starts feeling better, everything starts to kind of, they really start seeing the light at the end of the tunnel, and mentally they start coming out of their funk and they start feeling better. And, overall that actually helps with their overall recovery as well.
Kristy, can a patient offer a competitive edge in the off season, or keep that edge during the season by working with a team to improve power, speed, agility, conditioning, and coordination? It seems to me that all of the things that I just mentioned, speed, agility, conditioning, and coordination, are very important for a patient. So how do you answer that?
Absolutely. When it comes to a high level of performance, I often will kind of explain to my patients, I use the car analogy. Take our car in, we get it checked out. You wouldn't drive a car without fueling it properly, putting oil in your car. And your body's the same. We can just develop movement imbalances through life, through daily activities. So it's very important that an athlete understands his own body. For example, a pitcher, he's often going to be throwing to one side, which is going to cause an imbalance in his side-to-side musculature. So teaching them about different exercises, stretches, and stabilization techniques that he can do in the off-season to help prepare for his competition season. So and to help reduce the risk of injuries that can occur.
Yeah. Scott, let me ask you something. When a patient comes into your office and they don't exactly feel that bad, do you think that it's important as a preventative for people to come in and to just have you work on their body? Because prevention is very important, and I'm sure that if they take care of that, it won't increase, and it won't make a patient feel that bad. So with that said, again, prevention. Let's talk about that.
Prevention is very, very important, and not only for someone who has had injuries in the past, but just for anybody that is pretty active in their daily life, and even for the patients who are or the people who are inactive. Preventing falls, for the elderly patient is a very, very important aspect of what we do as well. Because if we can prevent the possibility of a patient falling, it over time it will save our entire healthcare system and save thousands and thousands and millions of dollars over the course of several years by preventing falls and hospital stays and fractures and all the different orthopedic issues that can arise from patients falling. The same thing goes for a younger patient who we're maybe trying to prevent a rotator cuff tear in a baseball pitcher, and we're trying to prevent those overuse injuries in just a normal weekend warrior type of individual who likes to go out on the weekend and play hours of tennis or softball, and we really try to work on just trying to prevent them from maybe getting a hamstring pull or a shoulder strain. So yes, prevention is a vital component for physical therapy.
I'm interested in knowing this, Kristy. Can each one of you help mitigate the risk of injury that comes along with sports, strenuous training, and demanding activities with your prevention and recovery packages?
Absolutely. With injuries, they can be tough because sometimes injuries can't be avoided. However, doing a thorough assessment and movement screen on a patient, it can at least indicate and help us to educate that person what they could potentially be at risk for based on how their body moves. And from that movement assessment, you can easily devise a stabilization program and offer techniques and things that they could do to further prevent those injuries from occurring. Absolutely.
Yeah. And what about, Kristy, what about accidents? I'm sure that people come into your office when they've had an accident and you treat the injury, but the most important thing is that they get better. So when they come into your office and you see and they, kind of say, well, I strain my back, I strain my neck, how do you talk to them? What do you say to them?
Well, how we address that, well, first we just sit there and just listen to their story. I get a patient, I bring them in the treatment room after they've completed their paperwork, and I just sit down with them and I listen. I listen to their whole story, and then when they're finished kind of telling me what's been going on, I further ask some questions to get to know the person. I like to get to know what they do for a living, what they do for hobbies, because that's going to give me insight as to how I can better care for this person. Then from there, I'll do the assessment and take a look at what's going on, and as I'm working with them, I will relate what I'm finding and then the things that we're doing to them being able to going back to those things that they enjoy.
I see. Oh, but, Scott, expert interventional pain management for pre- and post-operative surgeries, as well as orthopedic surgery. You take care of people after they've done that, haven't you?
After these orthopedic surgeries, is that what you're asking?
Yes. Yeah. Interventional pain management.
Yes. Well, we see lots of patients after surgeries, and generally, a lot of these patients are in quite a bit less pain after these surgeries. And when these patients talk about all the pain that they're in, and they're just deciding whether or not to have these surgeries, we certainly play a vital role in helping patients' decision making and helping them either try to prevent it or trying to get them ready for these procedures and to kind of get them geared up and ready for the whole process. So, yes, we are there for post-operative pain management and all the post-operative care, and we do see the patients probably out of any healthcare provider. We will see these patients most often, so we are a very vital component of their, either pre- or post-surgical care.
Yeah. Kristy, during this time of the pandemic, a lot of people were stuck at home, if you will, and they probably sat at their computers day and night and, they didn't move. They didn't do anything. How did that affect your business? Did you see more people, or did you, kind of recognize that stress really matters when there's an injury, or just people sitting around and doing nothing?
The lifestyle of being sedentary places patients at increased risk, especially for neck and back issues. When the pandemic first hit, I think we didn't really know what we were dealing with. So things slowed down as people were staying home. But as the pandemic continued, I think that people started finding other ways to be active, which I thought was great. More people were getting outside and playing with their kids. I heard a lot of stories of people starting to play pickleball in their driveways. However, that does place them at, activities from being sedentary to active can place them at increased risk for injury. I find that there weren't really any spikes in any injuries, I could say, from the pandemic, from being immobile, but the stress of not being able to do the things that they enjoy.
Do you treat patients who have Medicare and maybe a supplement? And if so, how long can they stay on that? And, if they have an injury or anything else, do you accept it? And if so, do people say to you, I need therapy and I only have Medicare and a supplement. So what do you do about that?
Absolutely, yeah. Medicare is, one of the most common insurances that we do see in our office. Medicare, obviously is required for if you are 65 and older. Most individuals over 65 have Medicare, and we accept that, and their supplement covers whatever Medicare does not cover. Medicare does have some limits with the amount of therapy that you can receive in a calendar year. However, those limits are mostly based on the medical necessities. So Medicare is not just going to have a hard stop to treatment because you've reached 20 visits. But at a certain point, treating the same injury, there has to be some medical necessity to their improvement and to their injury for us to justify continued treatment. So with that being said, that is a determination that is made by both the treating physical therapist and the physician, the referring physician, and the patient as well. So if medical necessity is not really established, then we usually discharge patients with home exercises and programs for them to continue with on their own. And if something is exacerbated or a new injury or a new issue arises, then we can certainly pick treatment back up with a new evaluation and a new treatment plan.
Scott, do you accept and do you think that it's important for people to do, such as, I'll give you an example of yoga or meditation or anything that really sort of makes people feel better? I think that yoga and various things that people can do to join with the situation that you'd have in your office is very important. What do you think of yoga, and what do you think of some of the other modalities that are important for people to do besides just going to see you?
Well, we always promote an active lifestyle, and there are so many different types of movement exercises that can be done, and there is really something for everyone. So we really, as we get to know patients, whether they've been, doing yoga for, prior to coming into us, or they've, been doing something else, obviously our goal is to get them back to that activity. If, as far as continuation of, keeping a healthy lifestyle, there really is a movement exercise for everyone. Yoga is not for everyone. It's an outstanding movement pattern that really helps with overall flexibility and core strength, and it really is, is effective in for keeping your joints healthy. But there's a lot of other different movements and exercises out there that is very, very effective for for each and every individual out there. So we would not try to give one movement exercise to and just generalize that for everyone. So everyone really thrives and excels in different things.
Yeah. Kristy, what do you enjoy the most about being a physical therapist? I mean, this is a light question, but I think our audience would be interested in understanding what makes you feel really proud of what you do.
That's an excellent question, Susan. It's very rewarding. I honestly wake up every day and it doesn't feel like I have to work is kind of how I knew I kind of picked the right profession. The ability to really make a difference in somebody's life and give them back something that, they had felt they'd never get back is just, it's a great sense of satisfaction and, very, very, very rewarding, and I had a story a couple weeks ago. A patient thanked me. He said, and my wife thanks you too, because now I can play more with the kids. And just it's the little things like that just, I think that makes the whole world a difference.
I have the same question for you, Scott. What is the most rewarding part of your job? Because needless to say, when somebody builds you up and says, I really thank you so much for doing what you're doing, how does that make you feel? It must be incredible.
Yeah, absolutely. It's the same thing that Kristy said. It is certainly a very rewarding career and place to work because, just the fact of helping patients, and it's, you always hear out there that, people have thankless jobs. It's quite the opposite with physical therapy. Patients are it's very rewarding and very nice to hear thank yous, and the fact that we're able to get patients back to what they really want to do, and seeing them through that whole process is really just amazing. And just a quick little story, that kind of sums this whole this little topic up is, Kristy has been working on a patient for quite some time with a pretty debilitating shoulder injury, and has had neck and back issues as well. And we've been working with this gentleman for on and off for about a year. And he just got discharged maybe about a month or so ago, and he's a very avid tennis player. So I invited him to come to play on my tennis team last night, and we needed an extra player, and he was getting back to playing, and it was just very rewarding. And to hear him, so thankful, and to say hi to Kristy, and to see him play at a level that he probably was playing at prior to him starting physical therapy, and just to see that. And to hear him say, if it wasn't for us, he probably wouldn't be able to play like he did. So that was just, really rewarding. And, thank you, Kristy, for getting him back on the court.
My pleasure.
I'm sure it was, and it's really wonderful what you guys do. Last but not least, I always like to ask my guests if they have something really important to say, because needless to say, and I said that once before, there's so much satisfaction that you get. So, Kristy, what's the last word?
My last word is just to be mindful, and self-care is always important. We go through life, through the day in, day out hustle and bustle of work and life, and one day things kind of can creep up on us all at once and all of a sudden. But, it's important every once in a while to make sure we step back, we reflect, and take inventory of where we're at and how we're feeling. That way, if we invest in a little self-care, a lot of injuries and surgeries can be clearly avoided.
Yeah, I think that's wonderful. And, Scott, did you ever think of writing a book? I mean, I know that's kind of comes out of nowhere, but the point is, I've never seen books on what physical therapy is all about, and I'm just wondering if you ever thought about writing something to give people the hope and the attitude that you can get better, and that is the most important thing.
Sue, if you would be my ghostwriter, we could definitely write a book. I'm not much of a writer, but there's a lot of stuff in my head that I've always said we can certainly write. That could be part of another chapter of the eventual book that I can write. And over the years, just the experiences that I've had, the patients and the people that I've met could each contribute to a pretty entertaining and knowledgeable book.
Well, I'm not a ghostwriter, but I'll tell you this much. You got Kristy in your office, and I bet she can help you on that. But anyway, I just want to thank you both for being on the Susan Brender Show. It's really been a pleasure, and I'm sure people have learned a lot. And, let's do it again in the future so that people really know and understand that there's hope in everything. Okay? With that said, thank you very much.
Thank you very much, Sue.